When we talk about healthcare in America, we often hear the phrase, healthcare is broken. But what does that really mean?
Unfortunately, most Americans have a really terrible experience. And there's probably nothing that's sort of more intimate or more personal to the individual than sort of their health and well-being. And it just was really something that we looked at and said, hey, there's got to be a better way to do this.
We'll explore the parallels between patient experience and customer experience on this episode of the CX Leader Podcast.
The CX Leader Podcast with Steve Walker is produced by Walker, a business consulting firm that helps our clients unlock the potential of their customer experiences by placing the customer at the heart of all their business decisions. You can find out more at walkerinfo.com.
Hello, I'm Steve Walker, Chairman and CEO of Walker Information, and also the host of the CX Leader Podcast. Thanks for listening to this great episode we have for you today. CX Leader Podcast has become the place for CX pros and executives that want to drive business performance via a focus on the customer, where we explore the topics that are of interest to you and also help your customers and prospects want to do more business with you. Unless you've been living in a cave for the past 2 or 3 decades, you've heard plenty of stories and opinions on how the American healthcare system is broken. And there's plenty of debate on the best approach to address the problem. My guest today is the co-founder of OurHealth, which offers a radically simple approach to workplace wellness by pairing convenient near-site and on-site clinics with a dedicated healthcare team to manage the everyday needs of employer workforces. Dr. Jeff Wells is the president and co-founder of OurHealth, based here in Indianapolis, and we're going to discuss his thoughts on healthcare, patient experience, and really how we're rethinking the primary care from the patient's point of view. And by rethinking the primary care from the patient's point of view, OurHealth is an advocate for the long-term health of employees and their wallets, and an ally to anyone who wants to make workplace wellness make sense. Jeff, thanks for being on the program. Welcome to the CX Leader Podcast.
Well, Steve, thanks so much. It's great to be here.
Well, we're delighted to have you on here, and you have to tell you, learning a little bit more about your company, it really is fascinating, and I think very hopeful for those of us that run a business and are dealing very specifically with the challenges in the healthcare system. So I actually probably couldn't do it justice, so why don't, for our listeners, just tell me the concept of OurHealth and what you're trying to do with this very interesting business model.
Yeah, no, be more than happy to. So in 2009, myself and a business partner, Ben Evans, recognized that healthcare delivery was really not working, particularly for patients as well as employers, both from a financial perspective and in terms of looking at outcomes. And we wanted to build an organization and a platform that would radically simplify that patient experience and ultimately drive more value for all the stakeholders in healthcare. So simply put, OurHealth is an independent primary care platform. We set up and manage clinics and directly partner with employer groups to make access easier for their employees and family members, provide a really holistic kind of preventive primary care model. And then we help individuals, if they need care beyond our clinics, make better decisions, ultimately yielding improved health and more savings.
So some people use the term concierge healthcare. Is it in that vein?
Yeah, good question. I think thematically, the concept of concierge healthcare, or some people use the term direct primary care, essentially is a collection of a number of different approaches to make access easier for patients and ultimately really focused on creating that better experience from the patient point of view. From that perspective, I do think that OurHealth is focusing in the same way.
And you are a MD. You are a medical doctor.
That's right. I went to medical school here in the state of Indiana. I had a wonderful experience. I got a business degree as well, and I think ultimately had a front row seat to see some of the challenges that both patients were facing. And then to your point earlier, unless you've been living in a cave for the last few decades, recognize that employers are consistently challenged with trying to pay for healthcare in a way that yields the kind of benefits for their employees. And so I was motivated to get involved in trying to make healthcare work better in a different way.
So you did actually practice medicine for a while?
I did through training. So I was trained as a primary care physician and then ended up having a cool opportunity to spend some time with the state of Indiana doing health policy work. So I had a chance to lead the Medicaid program for the state of Indiana for a few years. and then did some consulting work. And then Ben and I started OurHealth in 2009.
So was your motivation always to be in the business of providing healthcare, or was it something that you just sort of came about through your collection of experiences?
Yeah, I'm not sure that I had a clear map early on in exactly where I'd end up, but I do think I've always had, sort of these parallel passions. One is to really help people from a medical perspective, and I think the second is sort of an entrepreneurial kind of interest to, try to solve big problems and be part of a team that's trying to make, something work better.
Yeah, that's kind of what has struck me as I've learned a little bit more about your firm, is you guys really are offering a unique opportunity, I think, from what most Americans experience in the healthcare system today.
Yeah, unfortunately, most Americans have a really terrible experience. And if you think about, accessing care, on average, it takes 21 days for a patient to schedule a new appointment with the physician. We consistently see challenges from an economic perspective. In healthcare, what other part of your life do you have no idea what something's going to cost until maybe months after you've had the service provided? And then just trying to, navigate the complexities of different bills and different providers and hospitals and the insurance company that's arguing with the hospital or the physician that you saw. It's just extremely frustrating. It's confusing. And there's probably nothing that's sort of more intimate or more personal to the individual than sort of their health and well-being. It just, was really something that we looked at and said, hey, there's got to be a better way to do this.
Yeah. No, you actually hit on something that we've observed from our perspective. Is you are right. There is nothing more intimate or a more essential experience that you have as a consumer than when you're dealing with your health or the health of your loved ones. I think you were getting at the kind of the concepts of how it's broken. Could you also just talk a little bit about from the payer side or the employer side and how the system's broken?
Yeah, so in the U.S. today, about half of individuals get their health insurance coverage through their employer. So employers are largely bearing a huge financial responsibility. In addition to just the financial burden, employers care deeply about their employees. And that's one thing I believed in, early on in our career, but in everything we do with our business as we look at organizations, I think more than ever, business in the U.S. when you're competing globally it's going to be differentiated through your talent and through kind of strong culture. And so employers, I think, are trying to figure out how do we create the right type of culture, attract really talented individuals, and foster an environment where they can be their best. But here we are paying, 10, 20% more every year for healthcare that's not really driving, the beneficial outcomes that we would all want. And so I think it's a really frustrating place for employers to be in and has been for years. The traditional stakeholders have not been bringing real solutions. And employers have this, voracious appetite for something that really works.
Now, OurHealth, you do sell through the employer, correct? You sell your services and your concept through the employer.
That's exactly right. I think that's one of the unique things about our approach. We have not set our organization up to be a direct-to-consumer type of operation, and we also don't work directly through the insurance companies. So if you think about health insurers like Anthem or United Healthcare, Cigna, and others that individuals are familiar with, we don't work directly through them. And we wanted to prioritize partnering with employers for a few reasons when we built the business. The first goes back to a comment I made earlier, which is employers care deeply. They're highly invested in their people and in trying to drive the right types of outcomes, health outcomes and well-being, as well as the financial return. And secondly, by partnering directly with the employer, it sort of enables us to provide a different type of healthcare experience. We're able to spend more time with patients because the model's different. We're able to then, focus on the right types of services that drive improved wellness outcomes. And we think we can actually deliver a better experience from a B2B perspective with the employer because we're able to provide sort of more accountability, better information and insight without compromising, the individual confidentiality of any one person's information. But in the aggregate, we can kind of help the employer understand, hey, here's where the opportunities are, here's what's working, here's the impact that's being driven.
Yeah, so your experience for your clients is a better experience for their employees.
That's right.
It's kind of a neat deal there that you're out there helping them better engage and creating a better experience for their employees. At the same time, you're helping them have better outcomes in terms of big rising cost and a big constraint in some ways to having a successful business.
Yeah, that's right. So one of the things that we set out to do maybe about a year and a half ago was to really quantify the impact that we're making for our customers. And so we set this target that by 2025, we want to save $1 billion in healthcare costs for our customers. And our data to date suggests we're about $140 million of the way there. And as we continue to grow and see more success, we feel like we're certainly on the path to achieve that target. And then the second point I would make is from the overall, sort of employer-employee experience, the majority of our customers survey their employees to ask, hey, how do you like the culture of this organization? What benefits do you really value? And very consistently, the OurHealth solution, the on-site or the near-site clinic access ranks as the number one or number two benefit from the employee perspective. So it kind of helps reinforce that culture for our customers.
My guest today is Dr. Jeff Wells, an MD, and also the co-founder and president of OurHealth, based here in Indianapolis, and we're discussing how their company has provided a better patient experience for employers and is in many ways disrupting the existing marketplace for healthcare. Can you talk a little bit about what kind of experiences or what kind of options you're providing to employees that might be different than what they have access to today in their everyday version of consuming healthcare?
Yeah, absolutely. So from the patient point of view, so if you look at that employee and then they sort of put their patient hat on, I think the first difference that individuals notice is the ease of access. So convenience is probably more important now than ever. We see in other industries all of the technological innovation and development that's impacted us, from transportation to just access to media. You can think about experiences and travel and so forth. We sort of translate those same experiences to the healthcare expectation. And so I think we want to really bring down all the barriers. So if you have a need today, whether it's through sort of the virtual front end or actually physically getting into a clinic to see the physician or a health coach or the nurse, we want to make sure that can happen today. And we've been able...
You can call today and get in today?
Yeah, so like 99% of the time, if you call today, you will get in today. And if it's in the afternoon, if it's not today, it'll be tomorrow morning. And that's a key success metric for our organization because that expectation is there. Like I have a need right now.
It's kind of patient-focused too, I would say.
Yeah, and I kind of think it should be.
And you said the average earlier is 21 days?
Yeah, that's for primary care for kind of a new patient. For some specialties, it goes into the months.
Yeah.
It's just really frustrating and unfortunate. We've all had some experience, maybe for ourselves or maybe a loved one, where you're concerned about something. And the last thing you want to do is wait, sometimes not days, certainly not months, to sort of get an answer and figure out what's going on and what might we need to do about it. So I think access. And convenience is sort of number one. Number two would be maybe just more of a focus on wellness. Traditionally, maybe one of the most common refrains that I've heard from individuals that have access to our service, and I ask them the question, have you had a chance to use the clinic yet or to see the physician? And their response will be, thankfully I haven't been sick yet, right? So I haven't had to use it. And I think that's just a cultural sort of expectation we have socially, when the point is you shouldn't only go seek health care when you're sick. That's a very reactive, kind of more of a disease-focused model. And the reality, if it's working right, it should be, I'm going in proactively to make sure that I'm staying healthy, that I'm well, that we're kind of getting ahead of things and focusing more on lifestyle, right? So, there's data that shows 86% of all of our healthcare cost kind of ultimately come back to a chronic condition, things like diabetes and heart disease, asthma, depression, all of which have huge kind of controllable lifestyle factors. The decision to smoke or to quit smoking, to exercise, to eat healthy. Yeah, all these things that are pretty obvious, but certainly not easy to do. But we wanted to design a model that was really focused on promoting those things from more of a well-being and a prevention perspective.
How about for the employer? What kinds of changes are you making to the experience for the employer?
Yeah, so I think, again, the purchasing experience for the employer hasn't changed dramatically in decades. So traditionally, the employer, if you think about particularly the HR team and maybe the finance team, believes it's important to provide a healthcare solution for their employees, and they need to have a degree of health insurance. But there's very few options, and those options haven't changed over the years. And most of the decision making is really about shifting dollars. So maybe we ask our employees to pay a little bit more this year. We change the way that the deductibles are structured. But largely there's not a lot of options, and it's frustrating oftentimes for those employers. And on the other side, maybe they've made some investments in different wellness programs, focusing on trying to help their employees be healthier, live healthier, make smarter decisions, but they're not really connected to kind of the rest of that healthcare experience. And so I think what we can do for the employer, for the HR team in particular, is to try to help them stitch all that together. And then at the end of the day, have better information and more accountability to feel like, what am I really giving my employees, and is it really making a difference? Is there real value here?
Yeah. One of the things that we've always found from a customer experience standpoint is that a real key is speed. So when you talk about access, you talk about information being fed back. Were there inspirations from other businesses that inspired this? Or, were you looking at other industries?
Yeah, I think, again, if you look at financial services is one that comes to mind. And when I first, was old enough to sort of open a bank account, the only option you had for any transaction, as simple or complex as it might be, is to go into a physical brick and mortar bank branch and talk to a human being, a teller. Right? It could be as simple as I want to deposit $20, withdraw $20, or do some kind of estate planning or complex financial transaction was sort of all the same. Well, today, I go into a bank branch physically once about every other year for some kind of goofy, complex transaction. Everything else I do on my mobile phone. And so that's kind of an example of how an industry has really transformed that customer experience, over a decade or two. I talked earlier about transportation. Indianapolis is not a mecca of taxi cab companies. And so while it's not frequent, if you find yourself downtown and you want to hail a cab, it's impossible. I would call... back in the day, you call the 800 number, and, an hour and a half later, maybe if you're lucky, a cab shows up.
And it was a great experience, too, by the way. I remember waiting at the Indy airport one time for over a half an hour. And, how many airports back in the day would you have to wait to get a cab?
Yeah. And now we think about how different that experience is, with what Uber and Lyft and others have done. You don't even think about it. Literally you don't have to plan. If I make an instantaneous decision right now that I want to go somewhere, that can be fulfilled in a matter of minutes. And I think in healthcare, we haven't yet seen that kind of transformative innovation, and we need to for something so important. It's not always going to be just about convenience. Healthcare is more complex and it's more important than just hailing a cab from point A to point B. But it doesn't mean we should demand, less as society.
Well, let me talk about another big issue that we've seen in our work, and that's the more regulated a business becomes, the more driven by compliance, the less flexibility that entrepreneurs have to affect the experience because the experience is quote unquote regulated. How does the regulation of healthcare either affect or hinder what you're trying to do, and how do you see that playing out?
Healthcare is certainly a regulated industry, and for good reason in many respects. I certainly believe that the regulations can be navigated in a way that can still dramatically improve the patient and the consumer experience. I do think there's areas that maybe are less flexible than they could be. And a few examples, one would be around data security. And this is an ever-evolving topic. So just over the last year, you look at certain social media organizations and others where it's a global conversation around how critical it is that we protect individuals' personal information. And healthcare information is about as sensitive as it gets. So appropriately, there is regulation in the U.S. around that, and there should be. And appropriately, organizations work really hard to manage that. That being said, when you're trying to coordinate care across multiple different organizations, it slows down sort of the pace of innovation. And I think that's one area that there just needs to be a delicate balance to make sure that nobody's moving too fast. But we're also not so worried about, as you said, complying, that we actually don't deliver good health outcomes for patients and make that experience kind of work better.
Hey, as a customer-focused, patient-focused, market-driven guy, give me hope. How do you see the future unfolding, and what's it mean for our health and really for the consumption of healthcare?
Yeah. So I'm an eternal optimist, and probably in no case more so than in healthcare. And I think it's because it goes back to it is so important. And the demand coming from individual families, from consumers, is going to be unyielding. So individuals are demanding more personalization of their care, more convenience and accessibility of their care, and then just an overall, sort of improved relationship-driven kind of experience. And I do not see that demand changing. So I am absolutely confident that healthcare is going to continue to move in a direction of being consumer or patient-centered. And anyone that doesn't buy into that, I believe, will fail long term. That is a certainty in my view. I think another certainty for me is the continued adoption of technology as an extension of sort of the traditional healthcare experience. So, I believe it will be a very long time, if ever, that technology replaces the ridiculously talented individuals in healthcare, amazingly trained physicians and nurse practitioners or physician assistants or health coaches. I am a really fervent believer that healthcare is personal and relationship driven, and the mobile phone will not replace that. What I do believe is it will supplement and extend and augment that experience. And so the expectation that you shouldn't have to go into a physical clinic every time you have a need. You should be able to interact with your physician or your care team through the mobile phone or through different secure technologies. And I think that the overall care experience should be more seamless, and I do anticipate that will happen. And then finally, I guess my last prediction is it's an extremely dynamic, kind of chaotic time because everyone sees how important this is. It is the largest sector of the U.S. economy. Predicted, I think it's over $3 trillion currently in GDP, and by 2025 predicted to be $5.2 trillion. So there's a ton of interests that are coming in looking for innovative ways to try to help provide more value for customers, for patients. And I think, sort of that vigorous competitive, marketplace is going to ultimately lead to a lot of really neat outcomes that will make it better for people.
Yeah, you are an optimist, I think, and you're giving me hope, so I appreciate that. And I think you're absolutely right. The forces of what's right for the patients ultimately are going to win out in the end. Jeff, any other parting thoughts, any other things that we didn't cover that you would like to share with the audience?
I'm excited for the future, both for employers who I think are going to have more options than they currently have had, into the future, and it'll create a better experience for their employees, and I think help the bottom line of the business. And, just have really enjoyed the discussion.
Again, my guest this week on the podcast was Dr. Jeff Wells. He's the president and co-founder of OurHealth in Indianapolis. And if you want to learn more about this very interesting company, I really suggest that you visit them online at OurHealth.org. Jeff, thanks again for being on the CX Leader Podcast.
Yeah, Steve, appreciate the invitation. Thank you.
And if you want to talk about anything we discussed or about how Walker can help your business customer experience, you can contact me at steve.walker@walkerinformation.com or call me here in the U.S., 1-317-843-8890. Don't hesitate to reach out to me. I'd love to talk to you more about your customer experience. Don't forget to subscribe to the CX Leader Podcast. You can go to walkerinfo.com/podcasts, and you'll also find links to iTunes, Spotify, iHeartRadio, Google Play, all the wonderful places. And we've actually started even posting it on our YouTube channel as well. You can find those at youtube.com/walkerinformation. Thanks again for listening to this episode of the CX Leader Podcast, which is a production of Walker. We are a business consulting firm that can help you make customer experience your biggest competitive advantage. Find out more at walkerinfo.com. Thanks for listening. We'll see you next time.